see somebody lying down and you walk into the place, first thing you're going to do, there are some things that you check out for. Because I need an assistant that will join me to do this. I'm going to call Brother Kelechi. Please come and assist me. In such a situation, there are some things you should take cognizance of. First off, what caused this person to fall? What caused this person to be in that position? Be the first. And I say they are going to use DR, ABC, Dr. ABC. The first D is what? Danger. The R is what? Response. A is what? Airway. D is what? Breathing. And C is call or comment CPR. So the first thing you're going to do is, so that I explained earlier, I said ensure there is no danger to yourself, other passerby, or the patient. Then ask yourself, why has this person collapsed? Are there any hazards? Am I at risk? Danger could include moving vehicles and all that. Like all these are the things that would have caused this person to fall. Then after that, next is response. You try and wake this victim. Are they responding to you? You start by, look at how he's lying down. That's what you're going to do is, when in such a situation, you call for help. You call somebody to help you. Let's say you're the only one there, someone should assist you, like I've called for help. Kelechi, come and help me. So what you're going to do first off, when you see this person is, you find out whether this person is breathing. Whether the person is what? Whether the person is breathing. So look at the person's shoulder. My first knee is by the shoulder. And second, I reach very close to that person. Please come inside. Since you've learned this thing, what you're going to do is to direct the assistant. That's what you'll be doing. So you check first. As he's lying down, what I check his airway, whether he's breathing. You can do this by placing your hand very close to his nose, his nostrils. If that is breathing, you will know. Right? So what you're going to do now, after you've checked whether the person is breathing, you open the person's mouth. Because since he's unconscious, since the person is unconscious, the mouth can be open. So as you open the person's mouth, you're able to look into the person's mouth. And the next thing you're going to do is, you tilt the person's head backward. The person is helping me do this. Tilt the person's head backward and place the head chin, yes, the lifted a bit like this. So now, the essence of doing this thing is to make sure that the airway is clear. And I want to call it patent. Make sure that the airway is patent so that air can easily flow in breathing. When you do this, the person can start breathing. And in such a way it happens, look at what you're going to do. You just take the person's left arm, right? Place here. Place the person's left arm here. Next thing you're going to do is, you move the person this way, and then what you're going to do is to call for air. The airway is weakened. So you find out what exactly is wrong with this person. Now let's say the person is not breathing. The person is not breathing, then you do that, you tilt the person's head. You tilt the person's head like this, and then let your partner also move very close to you. What you're going to do now is very exhausting. Make sure that you've eaten, that you're not hungry. Make sure that you're eating because it demands a lot of energy and timing. That's every time I'm going anywhere, I always grab my wristwatch. Demand energy and time. Now what I'm going to do, you're going to do what they call 30 compressions of the heart, and then you do 2 rescue breaths. The 30 compression needs energy, and you do up to 100 to 120 compressions in 1 minute. Yeah, what I'm doing is mechanical. We're trying to mechanically make the heart to beat. Since the heart is not beating, we're trying to assist it. Its ability to contract naturally is no longer there due to the person having the cardiac arrest. We are going to assist the person mechanically so that the person will be able to get blood circulate within the body. And what we are trying to prevent is if blood does not flow to the brain for up to like 5 minutes, the person will have partial or temporary brain damage. So we want to prevent that. That's what we are doing. So the next thing we are going to do now is the compression. I know sometimes the worry will be to keep the person mouth-to-mouth resuscitation will be a problem. So you can use a handkerchief to place on the person's mouth. You can use the handkerchief to place on the person's mouth so that you will be able to do a mouth-to-mouth resuscitation. So since the person's head is like this, can you please stop this? So that you're not blocked. When I'm about to do it, I'll show you. Just stay at this. I think the person is like this, and you already place the person in this position. Look at what I'm going to do. Look at on your chest, the place where the rib cage terminates. Here, the breastbone is called what? Sternum. At the end of the sternum, just touch your chest. That's where you're going to place your hand. Okay, I forgot to mention something. And then before you confirm that this person is unconscious, there's something you're going to do. You're going to check for the pulse. You're going to check for the pulse. In the body, there are several places where you can find the pulse. Somewhere here. You put this on radial pulse. Touch it. Touch with your 2 fingers or 3 fingers. Touch here. The edge of your hand. Everybody should do it please so that you see. Excuse me. You can find it here as well. Look at the last place where you're going to check. Here. For the carotid pulse. Can you feel it? Can all of us feel it? Are we feeling it there? Don't use your tongue because it can, your own pulse might be what you will feel, thinking that it's the person's pulse. Use this or this. Here. Are you feeling it? So when you check the person, and then you check that the person, you don't feel any pulse here. What I'm going to do is, you place the dominant hand on the non-dominant, like this. Like this. Look at my dominant hand, this. This is my non-dominant. You place it on the non-dominant like this. You lock it. You place your hand there and you push it. That's why I need to do the compression. So you have to be very fast. You will not work with as the time is sticky. You have to be faster than the time. That's every microseconds, right? So you have to be very fast when you are doing the compression. 30 compressions in first 30 compression, then you give 2 rescue breaths. So you put it on the xyphon process, and then you push down 30 times. You keep pushing, compressing. As you'll be counting out loud. But anything you are doing in this situation, you'll be very fast, and you'll be proactive, and you'll be talk. Anything you want to do, tell them, bring this thing, do this, do that. Like as my assistant, like I tell you, come and stay here, do this. Do you understand? Because if you are not very fast, you will not be able to rescue this person. If you are very clumsy, nothing will work. Person will just pass. Person will just die. What you are going to do is, put your hand there, do 30 compression. You can 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26. Till you get to where? 30. Then when you've done that one, you give 2 rescue breaths. And the person's head is tilted. The person there, you tilted the person's head backward, right? So what you're going to do is, when you're about to give the rescue breath, make sure you put your hand there, and then pinch the person's nose. There's no pinch the person's nose so that the air does not go through the nose. Then you give rescue breath, put your mouth, cover the person's mouth, and then breathe in. You breathe in so much for within I think less than 30 seconds. You breathe in. If the air is going in very well, look at what will happen. The person's chest will rise. Because it's the lungs that are trying to inflate. The person's chest will do what? Will rise. And it will return back. Then you give the second one. If the chest doesn't rise, that means something is what? Blocking it. Then you check again, you inspect again if there's anything blocking the person's airway. God's grace, the person will be what? Resuscitated. If the person starts breathing, let's say you do that breathing, what will you do? You put that person in that position I showed you earlier, it's called recovery position. Take the person's left hand. See where I knelt. Look at what I said. I said that my knee is aligned with the person's shoulder, right? My knee is aligned. And some people there cannot see me. If you cannot see me, please feel free to stand up. If you cannot see me, feel free to stand up because you might use it to rescue someone's life. They say rescue the perishing. Care for the dying.